Hello to my beloved madam and fellow friends. How are you today? I would like to talk about HIV confronting the regular and bleak future. Did you ever ask you try to be a smoker and vapor when you're having a time together? I can say hang out with your friends at any places that you go. When you are about to join them smoking and vaping, you are suddenly remember that your parents are angry with you when they know you try to do something that can give you benefits because these things are smoking and vaping and the beginning of you to pain track ending. You think for a while and then you tell yourself, I cannot do these things that can give me benefits and totally can bleed my future immediately. So you try to avoid these things nicely when you ask your friends not to ask you to get involved in anything that can give benefits, include smoking and vaping. Talk wisely to not make an argument. But if you are about to try to smoking and vaping, you will and maybe get involved with HIV. If you get HIV, you will regret of your life because until now HIV not have any kind of medicines that can give you feel free from that. What did you do? It's too late. You just get HIV and then that's totally can bleed your future. So before I start my speech, let's know what is HIV. The disease here describe the HIV to have to give you bad life that smoking and vaping give you bad effects, but it is human's nature. HIV typically means a virus that fights the body's immune system, or we call it HIV human immunodeficiency virus. This can escalate to AIDS if HIV is not treated, acquire immunodeficiency syndrome. You can remain safe and avoid HIV transmission by learning the fundamentals of HIV. Since I have made a revision about this matter, HIV are defined at most AIDS or HIV-related deaths range from 14 to 24, and those age ranges are about my age. In most cases, such people are not defending themselves, and the other half were born with the viruses, but through the use of drug needles of you contracted the virus. I have also been witnessing the symptoms of the infection of a family member who have suffered from HIV for years. Let me explain how to prevent HIV in this video, and there are also ways to prevent the continuing transmission of HIV or AIDS. Firstly, how do you avoid sexual accusation of HIV? With little or no choice, choose sexual behaviors that's less dangerous than vagina or anal sex. There is little or no chance by oral sex of having HIV. HIV may not cause by sexual behaviors that do not have contact with body fluids, semen, vaginal fluid, or plug. Use condoms anytime you have sex the right way. Condoms, including gonorrhea and chlamydia, are particularly effective in combating HIV and other sexually transmitted diseases as STDs. Using lubricant dependent on water or silicone to help avoid the breaking or slipping of condoms during intercourse. Learn to use a male condom and a female condom the proper way. Tip PrEP. Pre-exposure prophylaxis is a drug used to avoid HIV by people at risk for HIV. PrEP is highly effective for the prevention of HIV from sex when taken as prescribed. Where it is not taken as recommended, PrEP is much less effective. Find out if you are right in PrEP. Decide not to have sex with your partner. Not having sex, also known as by abstinence, is 100% safe way to make sure you are not getting HIV. By sex, you may be abstinent at various points of your life for a number of reasons that can change over time. It also stop at STDs conception for not having sex. Get checked and processed for the other STDs. If you have another STD, you are more likely to have HIV. Brain screen and trip will reduce the risk of HIV getting. Many people with STD do not know that they have one because they have no sign. Find a research site they use. If your partner is positive HIV, advise your partner to get and remain in care. This is the most valuable thing your partner can do to keep you safe. If your wife takes HIV medication, it retains an undetectable viral, there is no effective chance that you will get HIV from sex with your partner. Read more about the effects of HIV treatment. Furthermore, if you have HIV, what is the simplest way to help others? Use pills icon. Take care of yourself and take medication to cure HIV. HIV medicines called antiretroviral therapy or ART will decrease the amount of HIV in the blood called viral load. People with HIV who have an undetectable viral load or remain virally suppressed will lifelong and stable life. Viral suppression is characterized as having less than 200 copies of HIV per milliliter of blood. If a person has an undetectable viral load, there is no effective chance of HIV transmission by sex to an HIV negative partner. An undetectable viral load also helps avoid spread to others by exchanging needles, syringes, or other injection devices and from mother to infants during pregnancy, delivery, and breastfeed. Most people will control the virus within 6 months. Taking ART does not prevent the spread of such sexually transmitted diseases, STDs. The next point is how do you avoid HIV from being compromised after recent potential contact, such as when the condom breaks or you are sexually assaulted. Learn about your HIV risk and how to reduce it. There is a drug you should take to prevent HIV from being contaminated after recent exposure. Speaking to the primary care physician, emergency department doctor, emergency can provide straight away a PEP. Post-exposure prophylaxis. PEP must begin within 70 hours of potential exposure. The faster you start with PEP, the better. It scans every hour. If you are prescribed PEP, you will need to take it 28 days a day. Will male circumcision prevent HIV from occurring? Check with your healthcare professional about the complications and benefit of male circumcision. Male circumcision does minimize the risk of HIV infection in some cases, but it does not reduce the risk of HIV as much as other HIV prevention options. Circumcisions men are less likely than uncircumcised men to get HIV from or said with the HIV partner. Male circumcision does not minimize the risk of HIV infection for a woman. The effects of circumcision of gay and bisexual men are not known. Circumcised men should take other steps to deter the transmission of HIV or to protect their partner. Should you be vaccinated to prevent HIV from occurring? There is currently no vaccine available to eliminate HIV. Besides, you also can keep yourself from taking HIV with injection drug. Never share needles, syringes, or other supplies for injection. Using flat sterile syringes and injection device anytime you inject it. Some cities provide systems for syringes to the wrist, SSPS, where you can get clean needles, syringes, and dispose of the expired ones. Safety: when you are sharing needles, syringes, or other injection supplies, use chlorine to disinfect it. A disinfected syringe is not as effective as a clean sterile syringe, but it will significantly reduce the change of HIV and viral hepatitis. Decide not to inject drugs. This is the only way to avoid HIV from going into injection drug use. Speak to a psychiatrist, therapist, or other healthcare professional about treatment for drug use disorder, including medication-assisted therapy. Lastly, how will you avoid the transmission of HIV to my child? Get screened for HIV as soon as you know your condition. The sooner HIV is diagnosed and treated, the more efficiently HIV trials can avoid transmission to your infant. If you or your partner indulge in conduct that places you at risk for HIV, get that screen again in third trimester. You should also urge your partner to have HIV screen, take HIV medication if you have, and take HIV medicines are recommended during pregnancy and childbirth, and give HIV transmission to your child could be 1% or less. In conclusion, now you know how to prevent from getting HIV. Prevent your future as much as you want. You also already know to solve this problem. You should start realize and take responsibility to make it clearly for your life. When you start to help yourself. Your self-confidence decreases, and all sorts of other things begin to rise. You know what to do all the things that can prevent you getting HIV. Don't give up. Trust on yourself. Do not try to take a smoke and away. Take my advice as much as you can to avoid getting involved with your drug. Thank you.